Now, America's healthcare advocate, Kerry Hall.
Hi, I'm Kerry Hall, America's healthcare advocate, and today I want to talk to you about Medicare Advantage special needs programs. What are those? Those are very different Medicare Advantage programs that are available to certain folks with certain eligible issues. So let me go through the three that are available. Number one, there's the SNP, C-SNP. That's C-SNP, Special Needs Program, hence the SNP. That's a chronic condition program. If you have a chronic condition, you may qualify for a SNP program. Dual eligible. What is dual eligible? That's a D-SNP program. Dual eligible means I'm on Medicaid, but I'm of the age where I can get Medicare, or I'm disabled in some way and would qualify for Medicare. So that's a dual eligible plan, which means you would keep your Medicaid, but you would also qualify for a Medicare policy. And then there's the institutional SNP or I-SNP. What does that mean? That means if you're in a nursing home or a facility someplace, you're incapacitated in some way, you may also qualify for a dual eligible plan, one of these plans. And the plan is the I-SNP plan in that particular case. Why are these important? What do they mean? Well, they're important for a number of reasons. Medicare Advantage plans, typically, a lot of them, most of them are zero premium plans, but they all have copays and they have out-of-pockets. So a typical Medicare Advantage plan might have a $30 copay for you to see a primary care physician. It might have a $50 copay to see a specialist. If you go get an MRI or a CAT scan, you would have a $350 out of pocket for that particular procedure. Maybe that's a $2,000 or $3,000 procedure, but you're still going to pay $350. And if you're hospitalized, typically you're going to pay $250, $300, $350 a day for like the first 5 days. So those are all out-of-pocket costs. And there's a maximum out-of-pocket on all the Medicare Advantage plans. Here's what's different. The special needs programs don't have that. Let me go through some of these. First of all, the monthly plan cost is zero. That means you pay no premium. The annual medical deductible is zero. Primary care provider visits cost zero. Special visits are zero. Inpatient hospital, which I just mentioned, typically under a Medicare Advantage plan, $250, $300, $350 a day for the first 5 days. Inpatient is zero. Outpatient cost. Again, if you have an outpatient surgery under a typical Medicare Advantage plan, it'll be $350 or $500. Now, when you're having a $10,000 outpatient surgery, that's not a lot of money, but still, under these programs, you pay zero for outpatient. Home health care is zero. Lab services, x-rays, that kind of thing, zero. If you go to the ER, again, it's zero for emergency room care. Urgent care, zero copay. So typically on a Medicare Advantage plan, an urgent care visit's like $35. Well, here you're not going to pay anything for this program. Brand or generic drugs, this is really important to understand. All of the Medicare Advantage plans have inside of them your Part D prescription drug coverage. That's included as part of the program. Well, on every one of those programs, you have copays. So if you take a generic drug, maybe your copay is $10. But if you take a name brand drug, then perhaps your copay is $35, $40. It could be more than that. It depends, okay? The special needs programs have zero copays for generic and zero copays for brand names, and they have expanded list of drugs. So they have an expanded formulary that includes a lot of drugs that may not be on a typical Part D prescription drug plan because people who have chronic conditions may need these medications. They may not be covered under a typical Part D program, or they may be limited. There's also on these plans no donut hole. So what's the donut hole? That's the part on a typical Medicare Advantage plan where the coverage stops, the allocation you get stops, and then you go into a donut hole. That doesn't happen on the Medicare Advantage special needs programs. Additionally, and these are some of the things that are really interesting, there is a food allowance. It's called the Healthy Food Allowance. It's typically $230, $250, $300 a month, depending on the carrier. There are only a handful of carriers that do this. United Healthcare is probably the biggest in the marketplace that does this, and they have multiple plans that they do this depending on the state that you're in. Dental benefits, up to $4,000 on a United Healthcare plan. And that's remarkable because while the Medicare Advantage plans typically have maybe $1,000 or $1,500, they don't have $4,000 in dental benefits. Routine transportation, this is another interesting part. So on the United plan, you've got 48 one-way trips to and from the doctor. So let's say you have a chronic condition and driving is a problem, public transportation's too far away, whatever the case. Maybe you're in a rural community where there is none of that, okay? Well, you've got the ability here to get transportation to and from. You've got 48 visits, 48 trips at zero cost to you. Routine vision benefits on this plan, $600 for eyewear. That's significantly more than a typical Medicare Advantage plan. And I'm reading off of the United plan designs just to give an example here. Routine hearing benefits, $3,600 allowance. So if you need a hearing aid, you've got a $3,600 allowance for hearing aids. That's really generous, and that really allows you to get a top quality hearing aid if you need hearing aids. And of course, you have free gym benefits, which is typical on most of these plans. But this is important to understand, and it's important for people who qualify for these plans to understand they've got these significantly enhanced benefits, and they really work well for folks that qualify. So I'm going to recap this one more time. You've got the chronic condition special needs plan called the C-SNP. You've got the dual eligible plan called the D-SNP, and you've got the institutional plan called the I-SNP. So those are the three plans that are available. And basically any individual with a severe or disabling chronic condition as specified by CMS qualifies for one of these. Now let me explain something to you. You can go up on the government website. I actually did that this morning, and you could print off the information there. And I'll be really impressed if you can figure out what it says. It's convoluted. There are multiple pages on Medicare Advantage. It's hard to find the special needs information, and the special needs information is pretty limited. My suggestion, to call an expert. I'm going to give you the name and phone number of a group of folks who do this all over the country. They're really good at it. The company is RPS Benefits by Design. You can pick up the phone and call them at 877-385-2224. They will be happy to help you. You can ask for a lady by the name of Carol Lee Steele or Joyce Thompson. Either one of those ladies can help you with these programs. Look, if you don't know whether you're going to, maybe you're a caregiver, right? And it's your mother that's in a nursing home and she's got a Medicare Advantage plan, but she doesn't have a special needs program. Well, guess what? Now you can get her on a special needs program. And maybe that will entitle her, maybe she needs hearing aids, or maybe she needs some other kind of care that these programs offer. So the way to find out about that is to call somebody that's an expert. Go online. They've also got a website you can go to. It's RPS Benefits by Design Inc. .com. That's the website. Inc. is INC. So if you just want to know, hey, I live in Florida and I need to know if I qualify for this plan, or I live in Nashville, or I live in Waukene, Kansas, okay? I need to know if I qualify for a special needs program. Maybe it's my mother, my uncle, my grandmother, my father, maybe it's my sister. You don't have to be 65. If you're disabled, you may well qualify for one of these plans. If you're on Medicaid, that's also important to understand. That's called the dual eligible plan. That's the one where you've got Medicaid, and people are afraid, oh, I'm going to lose my Medicaid if I go to Medicare. No, there's a dual eligible plan that helps you get Medicare, keep your Medicaid, and enhance your benefits greatly. I urge you, if it's you or you're a caregiver or someone who needs this care, you know someone that needs this care, maybe they're in your church or whatever the case may be, reach out to them and tell them to get this information. Give those folks a call. Call that number, 877-385-2224. Ask for either Joyce or Carol Lee, and just I need to know if I qualify for a special needs program. They'll help you, and you'll find out whether you get these benefits. I hope this has been helpful today and educated you in terms of the ability to get a special needs Medicare Advantage program. I'm Kerry Hall. Thank you for watching.